A good health system. We have some of the best doctors. We have good nurses. We do have good facilities. Is it a challenge to provide healthcare services in rural Alberta? Yes, it is. What you're talking about, the auxiliary, and the auxiliary not getting an okay for something that you've earned money for, I want to say to you, I mean, that's a challenge when something's earned, somebody has earned money for something that hasn't been approved, because if you earn money for something that is necessary, and that's great, and it is necessary, but you know, the doctor's got to be able to be on board. The nurses got to be on board. You need to have the people on board that can provide the services, and you need to have the funds to be able to do that. So, and I say to you that when you look at the family care clinics, this is something that's going to provide services for this area. Because right now what's happening is we don't have the doctors that are necessary. We need to have more doctors. Nurse practitioners will help alleviate the concerns, and a place like the medical clinic where you can acquire those services and have consultation and follow-up services is a step in the right direction, and I compliment the municipalities for working on this direction.
Thank you, Rick. Rebuttal from John. So everybody's heard of a fellow by the name of Dr. Raj Sherman, a friend of mine. Yeah. Kicked out a caucus, walked the floor, took over the Liberal Party by storm. He's got the answer to our healthcare sickness. He's got the prescription. And it starts with home care. And it starts with more long-term care facilities. And it means taking what the industry calls bed blockers out of the hallways and out of the beds and into a level of care that's more suitable for what they require. Once we do that, all of a sudden we free up all of those resources to manage when I have the big one, and let's be honest, I'm 260 pounds, this thing is a ticking time bomb here, right? When I have the big one, I like to know that my friends at the air ambulance, when I drop down and my wife calls the ambulance, the guys pick me up and they fly me to Edmonton, the resources will be there when all those people are out of the hallway and in a bed where they're comfortable and well taken care of. That is what Dr. Sherman and myself, as your candidate, will work towards. Dr. Sherman is giving you a 2-year guarantee that in 2 years, non-emergent surgeries will be taken care of within 6 months. No money out of your pocket, no privatization, none of that rubbish. Solid, dependable, provincial health care. Thank you.
I'd like to look at the facts of what Gladys had mentioned. This is your community raising fund for a necessary piece of equipment in our hospital. Private people in the community donating their funds. All of the doctors were on board. Everyone was on board. And the delay was the local MLA. And he gave a form letter. The MLA should be bending over backwards to work with groups like this who are raising funds in their own community for necessary equipment. One big issue that was talked about is this Premier Redford's plan of $2.4 billion to build, I think it's 140 primary care clinics. The Alberta Medical Association called Premier Redford completely out of touch because we can't staff the existing facilities. The Wild Rose plan is to put funds right to the front line, right to the doctor's hands. Thank
you. There are a lot of good ways that we can improve our healthcare system. John points out a very good one: build more long-term beds and get out the bed blockers. There's also investing more into home care and making sure that the people don't get sick in the first place and seniors can stay in their beds longer. There's also a government that doesn't instill fear and intimidation into their doctors. Now, Alison Redford said she would have a public inquiry into this circumstance. All she's giving us is an inquiry into queue jumping. Right. Well, the NDP called the police. We called the RCMP about queue jumping. They didn't find anything. And you know what? Doctor intimidation is even more serious, and yet now she's backpedaling on that promise as well. We deserve more in this province. We're also short doctors and nurses. We can also be working with the College of Physicians and Surgeons to get more doctors trained in those institutions who would like to come to rural areas. I have a friend who's now studying medicine in Thunder Bay. That was his whole objective for going into medicine, and you can bring those students. Also working to get more midwives accredited in this province so that we can have alternative forms of healthcare, but also decrease the strain on our healthcare system, and the NDP would do that.
And I just, I need to just maybe make a comment in regard to what was said by Mrs. Bovair. There's no doubt. I mean, we need to work together, and you know, Shane had said that I oppose this. I didn't oppose it. We worked together and had to work together with the Alberta Health Services. So why would I ever oppose something like that?
Any rebuttal?